Hello, everybody. My name is Alan, and I'm going to be speaking on behalf of the American Pacific Health Foundation today for our presentation. This is just a little bit of lessons learned, things that we picked up along the way, little tidbits that we found, useful pearls that might be helpful in your projects as well, especially if you're in the educational sphere. So our project is called Implementing Direct Outreach through the Train the Trainer strategy to raise awareness of LTBI and TB in San Diego's at-risk communities. I gotta say, I did not pick that name, but I was outvoted. To give you some background on what APHF is, well, like many of you, we're a nonprofit, community-based organization, and our project really focuses on delivering screening events for a lot of these underserved communities here in San Diego, while also providing really high quality health education so that these patients who might not otherwise have access to these healthcare resources can take their results, figuring out what the next steps are, and really get linkage to care. That's kind of the idea behind our core operations. So you can naturally see how the TA mini grant kind of comes into play, right? Because that is calling for TB educators, right? A specialized project with which we could use to expand current APHF operations. So that's kind of how we found ourselves in the TB sphere. And from there, where it all began is really a collective of individuals in our organization who wanted to figure out, okay, how can we set up a nice foundation, a nice clinical foundation that we can use to train our staff members so that they can go out and in turn work with the community and educate the community? And this lovely pharmacist, Dr. Michelle Fang, made a really fantastic presentation, very comprehensive, based off of her own infectious disease specialty work, but also the CDC resources, the county resources. And in assembling all of these together, there was a big, nice, thorough presentation that was created, really used for internal training for our staff members, mostly clinicians, and other pre-health students that were involved in our volunteer events. And that was a fantastic start. But we realized that we also wanted to incorporate the community into that educational method, right? So rather than have just our staff members go out into the community and talk to them, we wanted to involve the community members as well so that they could be talking to one another. And there wasn't really a way to do that if we were providing this specific presentation to them to use in their educational journeys. So we got together and we decided we wanted to make a simplified, non-jargoned version of that presentation that could be disseminated on a greater scale, right? That could be used in these community settings by audience members across age backgrounds, across educational exposures, right? So we created this little health ambassador program, which we implemented through the TB mini grant as well. And that core educational philosophy involved and revolved around this train the trainers idea, which is essentially using those core materials. We have a central group of staff members, clinicians that we're working with, right, that are trained clinically to kind of understand the pertinent information of tuberculosis. That team from there could then go off to different community fairs, farmers markets, these health events, schools to engage with the audience and to talk and encourage them to become peer educators of their own with these resources. After which, upon making these resources available to them, those trainers could go to their own events, their own families, their own social circles, and train other people, right? Get other people up to speed about what miscommunications and conceptions there were about tuberculosis or where they could get tested here in San Diego, so on and so forth. And one thing I will say is the mini grant has been extremely crucial in fostering this because one of the nice things that we were exposed to were different community-based organizations that were also working for the grant, but also just involved in the TB sphere here in San Diego. Different school systems that were now allowed to kind of bring us in to deliver these presentations. Different county partners that we met through different events that we could utilize in order to further our reach. And as a result, through all of that, we've broadened our reach way beyond what we ever thought we could accomplish. And through these training events, through these community peer educators, we've been able to reach nearly 1,000 collective members, individuals that have been instructed on where they can get testing information, about how to recognize some symptoms of active tuberculosis, so on and so forth. So really, it's been a gargantuan kind of endeavor. And it's been built up by all of these partners that we've had along the way. So just wanted to make that note. In terms of logistics, as you can imagine, for a community education project, this is pretty similar in format to most projects if you've ever participated, but pre-post assessment and educational intervention, and then of course the linkage to care, which might be the most important, crucial bit here. Because once we have these audience members engaged, thinking about, okay, well, could any of my family members have tuberculosis? Is that something they're even aware of that exists, right? How do they reach treatment? How do they reach testing facilities? Where do they go if they don't have insurance, right? All of these things, all encompassing, are what really we train our peer educators to do. And this is kind of the pipeline for our project. So that's a little bit about the project and things that we've kind of picked up along the way. The rest of this presentation really focuses on two key things that I've kind of encountered over the years through the iterations of the grant, which is relevancy and how we stay relevant, but also really why our project began focusing on younger and younger audiences and trying to incorporate them into the fold when oftentimes they were kind of neglected when we think about conventional education, right? So first off, relevancy, right? How do we stay relevant as educators? Oftentimes, I'm sure you've been in this scenario, you're at these health fairs, you're at these events that are really not designated for you specifically, but you are participating. And it's just so hard to get people interested, right? To get people to stop by, to talk to you, to have these conversations, even though this is crucial information that they really need to know, they may not be interested enough to kind of stick by. So how do we target that relevancy? How do we ensure that we actually spread our message? Luckily for us here in San Diego, we had an amazing TB summit, right? Full of these different practitioners, people engaged in the sphere, public health workers, county workers, educators, right? Clinicians, all in one place. And, really props to Champions for Health, the county, and all of their partners for setting this up, but all in one place were all of these TB practitioners. And we were all sharing different strategies that we were using, statistics, like ways that we could catch eyes on projects, like how do we expand our reach? And through that, a couple of things we found were very useful to use in our presentations, like specifically in educational capacity. One of which was this figure, right? Which kind of demonstrated, again, the upturn of TB incidence rates after COVID as people began getting more access to resources for like testing and so on and so forth. And so this is something that now we make sure to include in all of our presentations because it makes it topically relevant to the audience, right? The audience might not stop by to talk generally about, oh, tuberculosis, do you know what this is? They may or may not be interested. But when they see that, okay, well, tuberculosis incidence rates are kind of on the rise again after COVID, that's something that's eye-catching. It's relevant to them and it's interesting, right? It's something that helps continue that conversation and to provoke engagement. Same thing with this figure, right? Which we would not have had without the summit. A semblance of what regions are impacted by tuberculosis and where that is most prevalent, excuse me, right? So these little tidbits, these graphics, we obtained from the summit and we were able to incorporate into our own educational projects. So that's one way I think that we can stay relevant. It's really just regionally targeting your audience and ensuring that they know, oh, well, if we're delivering this presentation in like Chula Vista, closer to down south, like this is what the incidence rates look like here, right? And this is why it's relevant to you. The other thing that we found throughout trial and error is that death by PowerPoint is very much a real concept. And for those of you unfamiliar or have not worked in the educational sector, the idea being that a long lecture, right? Just talking to someone, you've all been in those meetings, right? Where someone's kind of just listing out points and talking to them. It's the same with health education, right? People in the audience are not going to be engaged if they're just being talked to, if they're just sitting there, which I know is kind of ironic because we're delivering this presentation like so. But really, like giving that audience an opportunity to engage rather than just to sit and listen and be bored, I think that's something that we found especially important, particularly as it concerns the younger audiences, which we'll talk about in a moment. But here are some tips that we found that kind of helps to elevate our TB education to increase that process. This is just an example of a modification of a lot of the core information that we provide at our events, but into a graphic instead for those visual learners and also for people to kind of visually track down, like, okay, what happens if I'm symptomatic versus not? Should I still get tested? So on and so forth. A simple change like this, instead of just a wall of text, is already an interesting way that you can get engagement from your audiences because they're guessing, right, what each step is. They're thinking about why each step leads to another. So that's one example. Framing some of these questions that you normally just give the answers to in the context of like case studies, for example, putting the audience in positions of leadership where they are in a practitioner's shoes. They're the ones making these decisions, thinking about whether or not it's a good idea to seek treatment. Why not? Right? It really empowers them to make decisions and to actively engage with their learning. And then, of course, classic activity that we always include in our educational events, just fun little callbacks, little mini puzzles like this, where, we've all done spot the difference activities. And in this case, there is no difference because SBI is not externally always very visible. But just little activities like that to get the audience engaging, talking with one another, kind of thinking about even how silly it is at times. All of those make the presentations more relevant. So that's something that comes up time and time again when we're presenting. And then lastly, I just kind of want to finish off with a couple of tidbits, things that I kind of picked up along the way about why we ended up focusing on younger and younger audiences and trying to incorporate them into the mix. And a lot of these things are really topics that you're probably already familiar with, right? Not only are you engaging interest in STEM, you're also promoting health literacy, right? You're utilizing their social connections, of which these younger audiences have so many, right? It's kind of the peak of social media right now for them to disseminate information, to talk to their friends, to bring this up with their families, to tell their teachers about presentations that they really liked. These are the reasons why here in San Diego, we found such great success in working with these students. And at the end of the day, when we're incorporating these younger audiences into the fold, we're not taking them for granted, right? Because I know we have a tendency to kind of focus on the adult population and the elderly. When we're incorporating this broad spectrum of our audiences into the mix, we're investing into the future of TB practitioners, right? Because these are the same individuals that will one day be treating us, that will one day be trying to clarify these tuberculosis misconceptions, right? So really, it's a low effort, high impact value method for ensuring that we're reducing the generational TB burden, right? That when we finish our work here, that there will be new iterations of passionate students, passionate youth that can also keep pushing that message forward of creating a TB-free future. So that's just our presentation, a couple of things that we picked up along the way, and just a reminder and really us imploring you to incorporate younger audiences as well as part of your educational projects. Thank you so much. If you have any questions, feel free to email us, reach out to us. And other than that, I hope the rest of the presentations go well.